Everybody. Thank you for the introduction. I've got enough slides to keep us going for at least an hour, but I'm going to try and whiz through them in about 10 minutes. So apologies if I go quite quickly. Quite happy to share a presentation and further information as we go on. So briefly, I'm here to talk to you about a project that we're involved with in Manchester, Manchester Health and Social Care Trust, working with their later life team and their memory assessment service specifically. I'm going to quickly dip into what that project was and then talk about a couple of the results from that. But as the title suggests, it was about doubling the throughput of referrals that their memory assessment service could work with. Briefly, who's Checkware? We're an e-health provider. We have a solution that's used for, if you boil it down to the bare bones, for collecting data for three key purposes. So one is around clinical treatment, so monitoring patients with long-term conditions, patients in mental health, with mental health problems, and then using that data in a structured and usable way for either research or for measuring quality, so outcome reporting, measuring the impacts of treatment. As a business, been going since 2007. We were started by, I don't know if any of you are football fans, but our chairman is the nephew of Nobby Stiles. He's a professor of psychology in Trondheim. At some point in the distant past, he went to live in Norway, and now that's where we reign from. About 170 customers use Checkware across Europe, and their service from our bases here in the UK and in Norway. So, backdrop of the project, the Prime Minister's challenge on dementia. I won't bore you with some of the details, but we know, obviously, from a World Health Organization perspective, it's one of the biggest challenges for the developed world, and expect to see numbers with patients with dementia rise to about 2 million within the next 6 years. In terms of Manchester, pretty similar to the big city near here. I still maintain that it's the third city, not the second, but people in Manchester disagree. And they receive around 1,200 referrals into the memory assessment services within Manchester each year. That's split across 3 areas. And the map on the right just gives a bit of an indication as to how they're performing nationally in terms of dementia diagnosis rates, which shows that they're sort of fairly average. Interestingly, they had other challenges in there. So the table on the right, and I think Vicky Sargent talked about this statistic earlier, but Manchester is classed as the 150th out of 150 health authorities for premature deaths in the UK. So they have certain challenges that are present there. And in terms of diagnosis, running around 44.5% diagnosis rate, so some way behind the Dementia Challenge target. I'll skip through some of these. So kind of the key part of the project, so when we started working with Manchester, the memory assessment service team there set up an expert working group whose job was to, or their aim was to convert their service into, or to build their service into a world-class dementia diagnosis service. And to do this, they wanted to increase the links and innovation with the university, which they work very closely with. They wanted a fast, streamlined, digitised service for processing and really assessing patients for diagnosing for dementia. They wanted to have measurable outcomes. One of the challenges they identified is they have all this data, it's on paper in disparate systems. They have no way of measuring the quality of their service. And all of this is to ensure that they continue to be commissioned into the future. So we started talking to them about a solution to support their assessment process. And 3 main questions to address there is, could it be adapted to their needs? If it could, would it be an improvement? And if it was, how big was that improvement? And that was really the kind of driver for the project. This was the process of the project. We initially engaged with users prior to the project to get a feel for how they would, whether they're on board with this as a positive thing. So actually using tablet devices to support their assessment processes. And generally the feeling was overwhelmingly positive. Many keen to be involved in the project. Next was a case of baselining the current process. So typical process is patients referred from primary care. They're seen by a nurse. They carry out lots of different tests, psychometric tests, cognitive measures, etc. And then they, along with other history information, they input that into a patient record and generate a report. That took around 3 hours. So we have here is the pie chart. 60 minutes of that was patient-facing time, 30 minutes was scoring of different measures and assessments, and then 90 minutes was compiling the final report. And interestingly, they had an error rating with their existing methods of around 16% errors within the manual scoring processes that were in place at that time. I mean, obviously that could be quite important, the difference between a positive or negative diagnosis, potentially. So the new method, put nice shiny iPads into everyone's hands, send them around when they see the patient in their home. They complete all of the processes they were doing on paper on an iPad, and that's automatically uploaded into the patient record, everything scored, and a full report compiled, available for the psychiatrist to deliver the diagnosis. I'll skip through here. So results, these were the objectives. Question at the start, will it enhance their practice? About 75% said yes it would. Afterwards we were up to about 90% of those involved in the pilot thought it was a useful tool and made them more efficient. This is really the key one for us. So the time spent to produce a memory assessment service report, beforehand I mentioned it was 3 hours. After the project, that time dropped down to about 60 minutes per assessment. So a huge time saving there. And this is really not changing the process dramatically, but just automating a lot of the back office processes that went along with generating that memory assessment report. Conclusions. How am I doing for time? I'm mindful I've been racing through this. So it's a solution definitely accepted by staff, embraced very much so. It was an efficient tool for collecting this data. The key thing we haven't talked about here is also, once we've got this data in, collecting these measures digitally, we have them in a structured form that's useful for helping them to measure the quality of the service, measure their outcomes, which they didn't have before. They have the data, but it sits on different systems, on paper. And then finally, the key thing is that they concluded they could double the throughput of the referrals in their service just by automating some of these manual processes. Lessons learned, engaging stakeholders early is always key. And this also involves your CEO, your information governance manager, IT team, all of those people. They recognise applications across other specialties. So here we focused on dementia, but also the psychological services. There's substance abuse services. There's also other areas where we're measuring long-term conditions and then the impacts of that on mental health as well. And then also progress reports and documenting that project was key to keeping momentum and keeping it on track. So that's me done. Just a quick acknowledgement. If anyone wants a copy, drop me an email. My details are there. Thank you very much.